Joining us now in the studio is Ruth Clout, Nurse Representative from the EBMT Cellular Therapy and Immunology Working Party, to talk to us about new cellular therapies and the impact on nursing practice. Ruth, thanks for joining us.
Thank you for having me.
So what's changed in cell therapy over the last few years?
Well, really, there has been a significant shift in cellular therapy, and that's since the licensing of the CAR-T products in 2018. So we saw that initially for acute lymphoblastic leukemia and lymphoma, and now in 2021 and 2022, it's mantle cell and also myeloma. So this is a really positive shift for cellular therapy treatments.
And what effect has that had on the nurse's role?
It has affected the nurse's role. For the clinical nurse specialists and transplant team, it's obviously increased their workload and the amount that they need to do for these patients, but it has also opened up other opportunities for clinical nurse specialists in the CAR-T role. For ward-based nurses, we're looking at different toxicities, so the managing of those as inpatients. So, for example, cytokine release syndrome and neurological toxicities require different assessments from the nursing team.
With all these new roles and with all this to learn, how easy is it for nurses to get the relevant training, and how's the EBMT filling those gaps?
So training is obviously a massive requirement for this, for cellular therapy, and it's really important that nurses do have that training. EBMT is an excellent resource in providing that for nurses. We obviously have the annual conference, there is also the CAR-T meeting, but allowing those events to be hybrid, make them more accessible for nurses. There's a whole multitude of textbooks via EBMT, online resources, webinars. So I think EBMT are doing a really good job at meeting the needs of those nurses and their training requirements.
What do you think the future of transplantation is, and what do nurses need to do to be ready for that?
So transplantation and cellular therapy is constantly evolving, but focusing more on the cellular therapy side of things, there hopefully will be more products available for different disease groups. Nurses need to continue to access available training resources to learn about different variances of treatments. And really, I think how we support patients in their patient pathway and utilising different methods of admission. So, for example, ambulatory care might be a good way that we can actually support patients through the transplantation and cellular therapy pathway.
Ruth, thank you. Thank you very much for joining us.
You're welcome.
It's been a pleasure. Thank you.
Thank you.